Welcome to everybody for attending today's webinar entitled HSAs, the Basics and Beyond. As the title suggests, we are going to be covering some basic information about health savings accounts, as well as taking a little bit of a deeper dive into some of the more unique features and attributes of health savings accounts. Before we get into our presentation today, I have a few housekeeping items. For those of you HR professionals who are looking for continuing education credits, this webinar has been approved for one general HRCI recertification credit, as well as one SHRM professional development credit. And your certificates of completion, along with a copy of today's webinar, will be emailed to you within about 2 to 3 business days following the conclusion of the webinar. In addition, the audio portion of the presentation today is available through your phone or through your computer speakers. Please note, if you have dialed in by phone, your phone will be muted throughout the duration of today's webinar to eliminate any background noise. And for those of you listening to the audio portion through your computers, please be advised the audio connectivity is contingent upon the quality and speed of your internet connection. So if you do experience short gaps or choppiness with the sound, I would encourage you to turn off your computer speakers and dial in by phone instead. We are scheduled for approximately 1 hour today. If you do have questions, please go ahead and type those into the Q&A function, and I will address as many of those questions as I can at the end of the presentation. My name is David Lindgren. For those of you who are not familiar with me, I am the Senior Manager overseeing Compliance and Public Affairs at Flexible Benefit Service Corporation. And before we get into the meat of our presentation today, I want to give you just some background information about our organization. As I've already mentioned, our company name is Flexible Benefit Service Corporation. We simply go by FLEX for short. We were founded in 1988, and August 1st marked our 28th year in business. We are headquartered in Rosemont, Illinois, a suburb of Chicago, and we have approximately 75 employees. We have 3 primary business segments. We are a third-party benefits administrator for employers nationwide. We are a general agency. Sometimes people refer to us as a wholesale insurance distributor. And we also have a sister company we partner with to offer health insurance exchange and marketplace services. As it relates to our third-party benefits administration division, we offer a number of different products and services on behalf of employers nationwide. Those include both health and dependent care flexible spending accounts, health reimbursement arrangements, health savings accounts. We also do administer COBRA on behalf of employers who are subject to that federal law, and we do offer a number of other compliance and administrative services, including the preparation of plan documents such as cafeteria plan documents, premium-only plan documents, and ERISA wrap documents. As of today, we have approximately 3,200 employer clients throughout the country, amounting to approximately 205,000 participants. Some of the services included with our reimbursement accounts include debit cards. We also do have CrossTech available through our HRA and our health FSA, whereby we have relationships with certain insurance companies who provide us with automatic claims feed so that we can substantiate those medical expenses and reimburse employees without having to complete any paperwork. As it relates to our health savings account, we are also a vendor partner with Healthcare Service Corporation. They are the parent company of Blue Cross Blue Shield of Illinois, Montana, New Mexico, Oklahoma, and Texas. And we do provide an integration with employers who do purchase their group insurance through Blue Cross in one of those 5 states. That allows automatic eligibility and employee claims data to be fed through their portal. We do have a number of different resources available. We do have an online benefits portal where employees can check account balances, submit claims, and find a number of different resources. We do have a mobile app, which does allow for easy claims processing and reimbursement. And we have a number of different other education and enrollment resources. I mentioned we are also a general agency. Sometimes people refer to us as a wholesale insurance agency. We partner with several thousand insurance brokers and producers throughout the country, and we offer those brokers and producers concierge-like services in the group health, individual health, and Medicare marketplace. And we do provide assistance to those brokers and producers with sales services, customer service-related issues, marketing resources, and we have a number of different business processing functions. Some of the insurance companies that we represent are listed on the screen and include companies like Aetna, Blue Cross Blue Shield of Illinois, and United Healthcare. Lastly, I mentioned we do have a sister company that we partner with to offer exchange and marketplace services that companies refer to as IX Solutions. And they have two different exchange solutions. IX Suite is a private exchange for employers. This is really designed to be an alternative to traditional group health benefits, and it's mostly ideal for smaller businesses who are not subject to the employer mandate, as well as mid to large-sized businesses who want to offer benefits to their part-time or seasonal employees, as well as their retiree population. And then we also do have, through that partnership, access to IX Store, which is really an online marketplace for individuals to purchase insurance plans that we refer to are on exchange, those that are subsidy eligible, as well as those that are off exchange and are not subsidy eligible. We do have an integrated call center and support service available through that IX Store partnership. Now, with that being said, we're going to move on to the core of our presentation. As I mentioned, it's entitled HSAs, the Basics and Beyond. And it does make the most sense to start with the basics. For those of you who are relatively familiar with HSAs, this will more than likely be a refresher for you. And for those of you who are relatively new to HSAs, you can kind of consider this your crash course into HSAs 101. Now, I want to start with some general information and then lead into how health savings accounts can almost serve as a solution or a partial solution to some of the information that I'm going to share with you today. It shouldn't be too surprising to most of you that health insurance premiums have been on the rise, and they are at an all-time high as we speak this year. But using a survey that was conducted by the Kaiser Family Foundation back in 2015, they asked employers information about their average premium of the plan that they offered, and they consolidated those numbers, and this is what we have today. So the average health insurance premium for a single person who receives coverage from their employer is about $6,251 per year, which equates to about $521 per month, and that's both between employer and employee contributions. When we start to take a look at family coverage, those plans covering two or more people, you can see the premium is drastically more. That average from 2015 is $17,545 per year, or $1,462 per month. So we're dealing with some relatively large numbers here when it comes to insurance premiums. And oftentimes we want to ask ourselves, well, why are premiums so high? How did we get here? Well, number one, we have medical inflation. This is a term that we relate to inflation specific to healthcare services. And medical inflation generally trends at a much higher rate than the consumer price index or other inflation indexes. Usually it's somewhere about 6 to 8% per year, could be a little more, could be a little less depending on the year, whereas general inflation has historically been somewhere between 2 to 3% per year. If you take a look at health plans, both self-funded and fully insured plans, the insurance companies and the employers will tell you employees are using their coverage more and more each year. The number of emergency room visits are increasing, the amount of prescription drugs that are being used are increasing, the specialty drugs that are being used are increasing, and so on. And then we like to pride ourselves here in the country as having some of the best healthcare available, and part of that comes with a lot of the new technologies that are out there. Well, as new technologies are introduced, they cost quite a bit of money, and the organizations that are introducing those new technologies and the medical providers that are offering them need to recoup some of those costs. And then we also do have a trend in our country, and have for several years, with increasing unhealthy lifestyles. The number of people that are deemed obese has been increasing year after year. We continue to have people that regularly use tobacco, that may drink excessively. In those that are now, we have quite a bit of people on the rise of people that are impacted by opioid addiction. And then one thing that's relatively unique about health insurance as it compares to any other type of insurance out there is that people regularly expect to use their health insurance. It's unlike a homeowner's insurance policy where people don't expect to use that policy unless there's a catastrophic event like a fire, or an auto insurance policy where people don't expect to use that coverage unless there's a catastrophic event like an accident, or a disability insurance policy where people aren't going to use that policy unless they suffer from either a short-term or long-term accident or illness that prevents them from working. But with health insurance, people do regularly expect to use that coverage. There's an expectation that at least a couple times a year, most people are probably going to need to see the doctor for a sick visit. For those of you with young children, especially infants, you're going to have some rather frequent pediatric visits, some more so than others. And then many people take regular maintenance medications where every month or every quarter they're renewing their prescription to treat an ongoing condition. And then there's also the expectation that at least some people will incur some unexpected medical expenses that will result in emergency room visits or surgeries or some other type of medical expense. So all of these things are drivers into the overall increasing insurance premiums. And there was another survey that was conducted by the HR affiliates, and this asked employers and HR professionals, how are they going to adjust to the Affordable Care Act and its requirements? For many employers, the requirements, both administratively and from a benefit standpoint, have also been driving the cost of insurance premiums upward. And for a significant number of employers that were surveyed, many of them said they would move to a consumer-driven plan. That would be a plan that it generally is a higher deductible plan that couples an FSA, HRA, or HSA with the plan. Many employers said they plan to increase their deductible or increase the copays. And almost half of employers said they plan to offer HSAs. Regardless of what the response was, we can sort of put all of those in the same bucket in that employers are looking to shift more cost to employees as a way to curb their own expenses of maintaining health plan coverage for their employees. And while cost shifting can help with controlling premiums, at least to some extent, that also means now your employees are going to be on the hook for more of their out-of-pocket expenses. They're going to have those higher deductibles, those higher copays, those higher coinsurance amounts. So if employees are going to have to take on more for themselves, why don't we give employees an option to pay for these expenses in the most cost-effective way? And that would be with some sort of tax-free account. And that's what leads us into our discussion here for the rest of our time here today on health savings accounts. They've been around for a little while now, but they still are relatively new, but really over the last few years, they've really been gaining momentum in terms of their adoption rate at both the employer level, the employee level, as well as those that secure HSAs on their own. But they were introduced back in 2004, and the general purpose of an HSA is to help people pay for their medical expenses with pre-tax or tax-free dollars. However, HSAs can only be established if certain criteria is satisfied. And if that criteria is satisfied, that HSA can be funded with dollars by the employee, by the employer, or a combination of both. And just a general statistic to tell you how much money is invested in HSA accounts today, or I should say deposited in HSA accounts today. According to some recent statistics that are available, total HSA assets are now somewhere around $30 billion. So there's a very big market for HSAs today. Now, I did mention that HSAs can only be established if certain criteria was met, and there's 4 general eligibility criteria. First, in order to participate in a tax-free account here in our country, you must be a U.S. taxpayer. Second, you must be covered by a qualified high-deductible health plan, also referred to as an HDHP. And we're going to discuss what that is here in a few moments. Third, you cannot be claimed as a dependent by another person. So for those children, as an example, that can be claimed as dependents by their parents, they would not be an HSA eligible candidate. And then lastly, for those people that do have other coverage outside of a qualified high deductible health plan, they cannot have another plan that is considered a non-qualified plan. Otherwise, that will eliminate their HSA eligibility. And I'll elaborate on that here in a few moments as well. Now, to describe a qualified high deductible health plan, there's just a few general pieces that you have to understand. And the definition of a qualified high deductible health plan is determined and the rules are established by the Internal Revenue Service or the IRS. But really we're looking at three primary things: deductibles, out-of-pocket maximums, and first dollar coverage. So first, in order to meet the definition of a qualified HDHP, a health plan that is covering a single person must have a minimum deductible of $1,300. If it is a family plan, that minimum deductible is $2,600. And the maximum out-of-pocket, that would be any additional expenses that are incurred after the deductible has been satisfied, such as coinsurance. The total maximum out-of-pocket, including deductible, cannot exceed $6,550 if the plan is covering a single person, or $13,100 if the plan is covering a family, 2 or more people. Now, these are the 2016 minimum deductible and maximum out-of-pocket numbers. They will also be the same for 2017. Now, the last criteria to meet the definition of an HDHP is that the health plan cannot have what we call first dollar coverage for any benefit other than preventive care. And first dollar coverage would be a benefit that's paid out by the plan prior to the deductible being satisfied. The most common examples would be an office visit copay or a prescription drug copay. You cannot have those copays in place prior to the deductible being satisfied. Otherwise, that would be considered a first dollar benefit, which is prohibited under the definition of an HDHP. However, you can have a first dollar benefit for general preventive care, such as your annual physical exams. Those can be covered with a small copay or no copay prior to the deductible being satisfied. Now, I did mention that if somebody did have more than one plan, they could not be covered by a non-qualified plan, or that would eliminate their HSA eligibility. So I wanted to just give some examples of the other coverage that is permissible versus coverage that's not permissible. This is not an exhaustive list, just some general examples. So if somebody did also have a dental or vision insurance plan, a short-term or long-term disability plan, a long-term care plan, or a critical illness plan, all of those types of plans would preserve HSA eligibility. However, if somebody did have one of these other types of plans, for example, you had a qualified high deductible health plan, but you had a second plan, possibly through your spouse, that was an HMO, or a non-high deductible health plan PPO, those would eliminate HSA eligibility. In addition, certain government health plans would eliminate HSA eligibility, such as Medicare, Medicaid, or TRICARE. And lastly, at least for my short list of examples here, certain health flexible spending accounts will also eliminate HSA eligibility. And when we get towards the end of the presentation, I'll tell you which ones do and which ones don't eliminate HSA eligibility. In terms of contributing to a health savings account, these numbers are set by the IRS and indexed for inflation. But the most that can be contributed to a health savings account in 2016 for a single person is $3,350. If the high deductible health plan covers 2 or more individuals, that would be considered a family plan, and the family contribution maximum is $6,750. The 2017 numbers will be the same for the family contribution. However, the individual contribution will go up by $50 to $3,400. In addition, anybody who meets the HSA eligibility requirements and is age 55 or older, the IRS does allow for a $1,000 catch-up contribution. Now, a question that comes up quite frequently at our organization is, what happens if a married couple, there's 2 people, a married couple covered by a high deductible health plan, and both people are age 55 or older? Is it just a $1,000 catch-up contribution, or is it a $2,000 catch-up contribution? And the way the IRS has written the rules is that each spouse can contribute a $1,000 catch-up contribution, but only if each spouse has opened their own HSA contribution or their own HSA account. So in that scenario where there's two HSA accounts, between the spouses, they each can contribute $1,000 into their account, and then they would decide between the two of them how they would want to split the remaining $6,750 in HSA contributions. So that's how the rules are today. That should be hopefully a takeaway for some of you. Now, one of the unique features about HSAs is something that we refer to as the triple tax advantage. They are one of the only types of accounts that exist today that are completely tax-free from start to end. Contributions are made tax deductible. Money that goes in the account can earn interest, and that interest is earned tax-free. And then as long as money is withdrawn from the account to pay for a qualified medical expense, which we'll define momentarily, that money can be withdrawn tax-free. Most other accounts that are tax advantage only have a double tax advantage. They're either taxed at the start or taxed at the end upon withdrawal. So HSAs are never taxed as long as money is contributed and withdrawn to pay for qualified medical expenses. And qualified medical expenses are generally defined in the Internal Revenue Code Section 213D. And in general, there is not a list that describes which expenses are or aren't eligible, but in general, as long as the money is being withdrawn to pay for or treat or prevent or cure or mitigate a medical condition, it will be considered a qualified expense. Now, we know that any out-of-pocket expense that's related to the health insurance plan, such as a deductible or co-insurance payment, would be a qualified expense. But qualified expenses go above and beyond just what's covered under the high deductible health plan. And although there is not a definitive list, there is an IRS publication, it's referred to as Publication 502, that does give you a good idea of what types of expenses are likely eligible to be withdrawn from your HSA on a tax-free basis. This is the publication that's used for people that take a tax deduction when they file their federal income tax return, and they have medical expenses in excess of 10% of their income. This gives them an idea of what expenses can be included. Just note that this should be used as a reference. It's not always going to be a qualified medical expense as it relates to the HSA. Now, some examples of qualified expenses are things like your deductible, co-insurance, any prescription drugs expenses, those would be qualified. Things like dental fees, eyeglasses, contact lenses, those would be qualified. Any lab fees, orthodontia treatments such as braces, LASIK surgery, diabetic supplies, hearing aids, those would all be examples of qualified medical expenses. Now, non-qualified medical expenses, you can still take money out of your HSA for a non-qualified expense. This is a differentiator between an HSA in comparison to an FSA or an HRA. However, if an employee or an individual does withdraw money from their HSA for a non-qualified expense, number one, income taxes are going to apply both at the federal and state level, and there's also going to be a 20% penalty on top of that. So for many people, if they're withdrawing their funds for a non-qualified expense, you could be looking at up to a 50% loss of funds as it relates to the penalty and taxes. Now, for those people age 65 or older, the penalty is going to be waived. So you can withdraw those funds and just pay income taxes upon reaching age 65 or older. That 20% penalty will not apply. Some examples of non-qualified expenses are cosmetic procedures that are purely cosmetic. For example, if somebody didn't like the way their nose looked and they had a plastic surgeon adjust the look and feel of their nose, then that would not be a qualified expense. On the other hand, if somebody had a deviated nasal septum and they needed to have a cosmetic procedure to help them breathe better, that would be a qualified expense. So just because it's a cosmetic procedure, we can't necessarily rule it out. We have to make a determination of whether or not that procedure is or isn't treating a medical condition. But some examples of some other non-qualified expenses include things like teeth whitening, hair transplants, maternity clothes, general toiletries, funeral expenses. And I've got a couple other items here. OTC drugs, which stands for over-the-counter drugs. Those are not eligible expenses from the HSA unless you have a prescription from a doctor. So while you don't need a prescription to buy things like NyQuil or Tylenol, you do need a prescription for it to be a qualified expense to be withdrawn tax-free from your HSA. Similarly, with weight loss programs, those are not qualified expenses unless they are treating a specific medical condition. So if somebody, for example, is considered obese by their provider and it's recommended that they join a weight loss program, maybe to reduce their cholesterol level or their risk of diabetes, then as long as that's treating a medical condition, then that would be considered an eligible expense, but otherwise it would not. Now, what we find, I'll take a step back. That really, for the most part, summarizes your basic information as it relates to HSAs. And in our experience, we find a lot of employers are very good at explaining the basic information, talking about how a higher deductible health plan is generally going to have a lower premium than other plans. Therefore, employees are going to have more take-home pay. Information about communicating things like what are eligible expenses and potentially ineligible expenses through the HSA, what those contribution limits are and how they adjust from one year to the next. But we really find that those employers that take the effort to go above and beyond communicating the basic information, they tend to have a much greater participation rate in the high deductible health plans, as well as a much greater buy-in from employees and a greater overall experience and happiness amongst the coverage that they have. So I want to talk about HSAs now a little bit beyond the basics, and I want to talk about it, some advantages from the employee's perspective, and then towards the end we'll talk about advantages from the employer's perspective. But from the employee's perspective, I really think, and I think our organization as a whole would agree, that if you can explain the unique ways that employees can make contributions to their accounts, as well as how they can use the account in terms of withdrawals and some other features, you're really going to help them understand how powerful an HSA can be and how valuable it can be in helping to pay for medical expenses incurred by themselves, as well as any covered dependents. And I really do think that the greatest feature of HSAs is its flexibility. And when we talk about all the unique ways you can make contributions and withdrawals, there can be some confusion that comes with that. And that's why if you can sort of take things one step at a time and communicate this relatively frequently and relatively clearly, you're going to have a greater buy-in and happiness from your employees as it relates to enrolling in a high deductible health plan with an HSA. Now, the first to start out is that anybody can fund an employee's HSA, and that those dollars will not be treated as taxable income to that employee. So, of course, the employee can make a contribution. The employer can make a contribution. Any family member of the employee can make a contribution to their HSA. Their friends, their neighbors, anybody can contribute to the HSA, and that money will not be taxable to that employee. Another advantage is that HSA dollars can be invested. That's going to be unlike FSA dollars or HRA dollars. This is a unique attribute to HSAs. Now, depending on where the HSA is established, each custodian, generally it's a bank or some financial institution that is the custodian of the HSA, their investment options will vary. There'll be some that may not have any investment options, and there'll be others that will have every publicly traded investment option available, or at least most of them. So these HSA dollars, you can invest them in stocks, bonds, mutual funds, or other publicly traded investment vehicles. and any interest that is earned is tax-free. Now, you also do have to keep in mind, taking a look at this from the other side, that money invested in the market is subject to market risk. So you're not always guaranteed a gain in your investment. You could experience a loss. So there is that market risk, but this is a valuable option to employees. In terms of account balances, the sky is the limit. There's an unlimited rollover amount. There's no cap on what those accumulated balances can be. Employees are only subject to the annual contribution limit. So that's it. We at Flex have been administering HSAs since they were first introduced back in 2004, and we have a handful of HSA account holders that now have more than $100,000 in their HSA because they've been fully funding it year after year, and they've been investing those account balances. Another unique attribute is that HSA funds are portable. Unlike FSAs and HRAs and other medical plans, HSAs are not considered group health plans, but rather they're considered a financial instrument. They are the property of the account holder. They are not the property of the employer. In general, HSAs are not subject to COBRA, although the high deductible health plan would be for those employers with 20 or more employees. But even though it's not subject to COBRA, if the employee terminates employment at the employer, that HSA account goes with them. Those funds go with them wherever they are moving to. Now, in the event an employee does terminate their employment with the employer, that employee may continue to make contributions to their HSA after their employment is terminated, but only if they continue to remain HSA eligible. If their HSA eligibility ceases, for example, they no longer are covered by a qualified high deductible health plan, their contributions must stop. They cannot make any future contributions to the account, but the remaining funds that are in the account can be withdrawn tax-free for qualified medical expenses. In terms of HSA contributions, if the high deductible health plan covers just a single employee, that employee's contribution limit is subject to the single-only limit, which was $3,350 this year. However, those HSA funds can still be used for their spouse or their tax-dependent children, even though that spouse and those tax-dependent children may not be on that high deductible health plan. So that's exactly how I use my own HSA account. I have a single-only plan through my employer. I have a spouse and a child in which I use my HSA funds for their medical expenses. Contributions are available at the family limits if the high deductible health plan covers the employee plus one or more family members, even if the other family members have other non-qualifying coverage. For example, take a husband and wife as an example. Let's say the husband is the employee. He meets the HSA eligibility guidelines. He's able to contribute that $6,750 to the HSA if that high deductible health plan also covers his wife, even if his wife has another non-qualifying plan such as Medicare. In terms of making contributions, if a person becomes HSA eligible in the middle of the year, that HSA contribution is supposed to be prorated on a monthly basis, again, for those who are not eligible for the entire year. But there is a special rule for first-year enrollees. If a person becomes HSA eligible by December 1st, and they remain HSA eligible for all of the next year. So as an example, if somebody became HSA eligible by December 1st, 2016, and they remained HSA eligible through December 31st, 2017, so the end of next year, then they can contribute the full HSA contribution, the full annual amount for the 2016 year. There are a couple different options to make HSA contributions. My preferred recommendation for contributions is through payroll deduction, pre-tax payroll deduction through the employer. Why? Because it's going to avoid federal and state income taxes. There are 3 states, Alabama, California, and New Jersey. Unfortunately, that do not allow for HSA contributions to be tax-free at the state income level, but all other states do allow it. But payroll deduction, you generally avoid federal and state income taxes, but you also avoid the FICA taxes, Medicare and Social Security. So you get that extra. Medicare and Social Security amounts to 7.65% for most individuals. So you get that extra 7.65% tax savings. And what I also like about payroll deduction is every paycheck money is going into the account. So there's a consistent flow of money into the account so that when somebody actually needs to use the HSA, there's likely money in the account that's available to pay for some or all of their out-of-pocket expenses. Now, there is another option. An employee can transfer funds or make a deposit to their HSA outside of payroll deduction. And when you do this, you simply take a tax deduction for your contribution at the time you file your income taxes. And if employees that do this, they determine the frequency of their contributions. They can put money in their account every day if they wanted to, once a year, once a month, once a quarter. They just cannot exceed the annual contribution limits. In terms of the timing of HSA contributions, individuals or employees have until the end of the tax year to make contributions. So for most, that's going to be until April 15th. So the 2016 contribution limits have to be made by April 15th, 2017. One thing to keep in mind, though, is that expenses are not eligible or are not considered qualified until the HSA is actually established. So my general recommendation to people is as soon as you're HSA eligible, open that account. And then you decide when you want to contribute money after that. But as long as that account is open, the expense will be considered qualified, even if you make a contribution at a date that is later than when the medical expense is actually incurred. So there's a couple different funding philosophies that we believe are common in the HSA world. And the first is to simply fund the account up front. Put in up to the maximum limit for the year at the start of the year. That's going to provide an immediate balance of money for both expected and unexpected medical expenses. And then, assuming you didn't fully fund the account up front, the employee would just replenish funds as needed. So that's one funding philosophy that is available. Another is to fund the account after the year is over. But once again, open that account as soon as you become HSA eligible. That way we know medical expenses will be considered qualified. An employee would then pay medical expenses through another vehicle, such as a checking account or savings account. That employee would track their expenses that they incurred during the calendar year, and then they would add those expenses up, and they would make a contribution to their HSA by April 15th, and then they would simply reimburse themselves tax-free out of the account. That way, the employee is getting the tax deduction for the exact amount of their medical expenses incurred up to, of course, the contribution limits, ensuring that they're not over or underfunding the account. Now, another philosophy is to save for the future. This would be where somebody would be making contributions to their HSA, and they're going to pay for their medical expenses through a different vehicle, such as a checking account. And they're going to do this over the course of several years. And they're going to track their medical expenses incurred over this substantially long period of time. And then at a later date, they're going to reimburse themselves tax-free for several years of accumulated medical expenses. And we're seeing this commonly done today because of healthcare in retirement. I don't know how many of you follow the Fidelity Benefits Consulting firm, but they're a great firm that puts out some good information, and every year they put out information on how much will medical care cost in the age of retirement for the average 65-year-old couple that retires. So this is based on 2015 numbers, but the average 65-year-old couple in retirement is expected to spend $245,000 in today's dollars to cover their medical expenses in retirement. This would include Medicare premiums, prescription drug expenses, other out-of-pocket expenses. That's a large number, and I think a lot of employees aren't taking those expenses into account for their general retirement plan, such as their 401k. So the HSA has a little bit of a nickname for those people that are savers and want to use their account for long-term savings. And some people are referring to an HSA as a medical 401k or a medical IRA. And the reason being is they work very similarly to 401ks, but they actually have one added feature. HSA contributions are tax deductible, just like 401k contributions are. HSA funds can be invested and earnings can grow tax deferred, just like 401k funds. And HSA funds can be withdrawn in retirement tax-free for medical expenses, unlike 401k withdrawals. So this is where the HSA has that triple tax advantage feature, whereas a 401k would only have a double tax advantage feature. So interesting way that HSAs are being portrayed now and how they can be used, and it's completely allowable under the tax law. Now, another attribute of HSA is, as we like to say, it's consumerism at its finest. You know, once an employee contributes money into the account or the employer contributes money into the account, it's the employee's money. It's their own money. And employees, and really people in general, they tend to spend their own money differently than someone else's. We always like to use the analogy of, say you somebody went to a grocery store and you let them pick out anything in the grocery store and they didn't have to pay a dime for it. So what would they pick out? If they were a meat eater, would they pick out the steak or would they pick out the hamburger meat? Would they pick out the brand name stuff or the generic stuff? So you get where I'm going with this, in that if it's somebody else's money, individuals, it's just human nature. You're going to take the stuff that's more expensive. But when it's your own money, you start to think about things differently. And you start to become, when it relates to medical expenses, a smarter consumer of your health care. So you might shop for your doctors. As an example, I live close to 2 different urgent care facilities, and I had a bad sinus infection a few months back. I went to my normal urgent care clinic, and I know that after I received my negotiated rates, the claim goes through to the insurance company, that it cost me $65 per visit. Well, I went in and I had that sinus checkup and paid the $65 through my HSA, and then a month later the sinus infection came back. I went to that urgent care clinic, and there was about 15 people in line in front of me, and there were only 2 doctors on call or on staff. So I decided I didn't want to wait that period of time, so I went to the next urgent care clinic. First time I'd ever been there. Well, after the claim went through and got processed, I got the negotiated rates and I got my bill. The cost for that urgent care clinic was $170. So I now know for virtually receiving the same service, I can go to my normal urgent care clinic and pay $65, or a different one down the road and pay more than twice that amount. So from my perspective, I now have a great reference point to know that I want to use that cheaper doctor when at all possible. In addition, if it's people's own money, they're going to tend to at least give consideration to generic drugs versus brand name drugs. And as it relates to things like surgeries, they're going to give consideration to outpatient facilities versus inpatient facilities, as inpatient tends to be 2 to 3 times more than outpatient. So people become smarter shoppers as time goes on because they are essentially self-insuring until their deductible has been met, and that HSA money is their own money. So in essence, as you become a smarter consumer, it results in a lower level of cost for everyone, both the employee and the employer, in terms of their utilization and their renewal rates. Now, health savings accounts and how they interact with flexible spending accounts and health reimbursement arrangements, or FSAs and HRAs, is that there are circumstances when you can have an HSA and also an FSA and or an HRA, but only if specific criteria is met. First, that FSA or HRA can only reimburse what we call accepted benefits, things like dental or vision. So if you have a dental and vision only FSA or HRA, you can have that FSA or HRA as well as be enrolled in an HSA. Also, if the FSA or HRA is what we call a post-deductible FSA or HRA, one that doesn't kick in until after that minimum HSA HDHP deductible has been satisfied, $1,300 for single, $2,600 for family, you can then have both an FSA and or HRA along with an HSA. Now, one thing to point out is that a lot of people overlook this, is that when you have a married couple and that spouse has an FSA or an HRA or both through their own employer, that will eliminate HSA eligibility unless it is an accepted benefit FSA or HRA or a post-deductible version. So keep that in mind. Coverage through the spouse, if it would reimburse the employee, would eliminate their HSA eligibility. Now I want to sort of wrap things up here talking about some of the HSA advantages from an employer perspective. And the first is, going back to education. It's key when it comes to, health plans in general. They can be complex. A lot of terminology gets thrown around that employees aren't accustomed to. But we find that the perception is often distorted, especially if you're introducing a high deductible health plan and an HSA for the first time. Number one, flexible spending accounts have been around for around about 40 years. HSAs have only been around for about 12. And a lot of times, for whatever reason, employees automatically assume an HSA and an FSA are the same thing, when in fact we know they are different in many ways, although they do have some similarities. And then anytime you're talking about a high deductible health plan, sort of the immediate reaction is, okay, that's a high deductible health plan. This is not a very good plan. And I think as a result, that's created some participation issues, some hesitation from some employers either adopting these types of plans or those that have getting participation in that plan. And in fact, even those employees that are enrolled in a high deductible health plan and that meet the HSA eligibility criteria, different experts out there say anywhere between 40 and 50% of these employees aren't opening an HSA for one reason or another. So I think when you talk about high deductible health plans and HSAs, using some general numbers are a great way to communicate information. And some numbers that I'm going to use for you are just average numbers. I would encourage you to use your own specific numbers when doing the analogy and comparison. But when I started off the presentation, I said the average health insurance premium for a single person is $6,251. Well, the average premium for a qualified high deductible health plan is $5,312, so almost $1,000 less. And when we take a look at the family plan, I started off the presentation telling you the average premium for a family health insurance plan is $17,545. Well, if it's a qualified high deductible health plan, the average premium is $15,379, or $2,000, more than $2,000 less. When we take a look at the average deductible for a qualified high deductible health plan, it's $2,196 for a single person, $4,347 for a family. And I want to show you some math here and how it makes sense in that when we take a look at the premium savings and the tax savings through HSA contributions, the economics really starts to eliminate a significant portion of that deductible, therefore, eliminating that perception that the high deductible health plan is a low quality plan. So just using the numbers on the left, the average qualified high deductible health plan has a $2,196 deductible. Well, we know that plan right away, because it's a higher deductible plan, is going to result in premium savings on average of $939. And then if we assume somebody is fully funding their HSA, either through employer contributions, employee contributions, or a combination of both, there's going to be tax savings, assuming a 25% total tax savings between federal income, state income, and FICA taxes of just over $837. So when we subtract the premium savings and the tax savings from the HSA contributions, you're left with just over $400 in total deductible. So those savings can really offset a significant portion of that deductible. And the math works similar for the family plan. We know the average qualified high deductible health plan deductible, at least from 2015, from the Kaiser Family Foundation survey, is $4,347. But the average qualified high deductible health plan is going to have a premium of $2,166 less. And again, if we fully fund that HSA at the family level, there's going to be almost $1,700 in tax savings. Again, taking away almost all of that deductible, just shy of $500 left. So the economics really start to make sense in many scenarios. And in terms of employer contributions, it's an option, it's not a requirement, but we see a lot of employer contributions structured in one of two ways. Fund matching is a popular option to encourage participation in employee contributions. So not too different than a 401k fund match. So as an employer, you can match, a dollar for dollar or a percentage on the dollar up to a certain limit. It's really up to you. We just got to keep in mind the annual contribution limits. And then also, as wellness programs are becoming more popular, we are seeing more and more employers offering a wellness incentive for those employees who satisfy the wellness program requirements. That incentive is coming in the form of an HSA contribution. So something to consider if you are making contributions or are considering making contributions. And when making contributions, there's a term comparability that gets thrown around. Comparability is where an employer would have to make the same contribution amount from a dollar perspective or a percentage of the deductible perspective. But comparability rules don't apply as long as contributions are going to be made inside of a cafeteria plan. And most employers are going to structure it that way, and if they're not, it's probably just because they're unaware that their plan documents are not updated to reflect that. So they need to do a plan document check there. But as long as contributions are made through a cafeteria plan, as an employer, you can deviate the contributions that you give one employee versus another. Just keep in mind that non-discrimination rules do apply. So if those contributions are structured to discriminate in favor of in general, your highly compensated employees, you may have to tweak those contributions to pass those non-discrimination rules. But I want to talk about non-discrimination rules as one of my last things, in that I want to first talk about them with an FSA for comparison purposes, in that let's say you had a cafeteria plan which allowed for pre-tax premium contributions as well as pre-tax FSA contributions. Well, there would be 5 non-discrimination tests. There would be the first 3, the eligibility, contributions, and benefits and key employee concentration tests. Those are all cafeteria plan specific non-discrimination tests. Then you have separate tests specific to the FSA as it relates to eligibility and benefits. Well, if you have a cafeteria plan that just allows for pre-tax premium and HSA contributions, you eliminate 2 of the 3 cafeteria plan tests. You don't have to worry about the contributions and benefits test, and you don't have to worry about the key employee contributions test. And if your plan is fully insured, you don't have to worry about the eligibility or the benefits test. You do have to worry about that if your plan is self-insured. But there is as it relates to getting rid of 2 of the 3 cafeteria plan eligibility tests, there's a simple test that's referred to as the safe harbor test for eligibility, which says as long as the ratio of non-highly compensated employees participating in the plan is at least 50% of the highly compensated employees, then you automatically pass all of the cafeteria plan non-discrimination tests. Just to show you an example of what that would mean in terms of passing, let's say you had 30 highly compensated employees. 25 of those 30 participate in the plan, so you got just over an 83% participation rate. Then you have 100 non-highly compensated employees, 47 of which participate in the plan, or a 47% participation rate. When we take the ratio there, 47% divided by 83.33%, we get a percentage of 56.4%, which is greater than 50%, which gives you an automatic pass. So if non-discrimination tests aren't really your thing and these numbers are a bit overwhelming, just realize that when you have an HSA versus an FSA, it generally becomes a lot easier to satisfy non-discrimination testing. So just to wrap things up here, HSAs been around 12 years. People are starting to really become aware of these, but education is still key. I'm hoping there was at least a couple things that you were not aware of that you became aware of in today's presentation. But the triple tax advantage, all the different funding options employees have, all of the different ways they can withdraw money, the fact that they can invest their funds, they can save for the future in medical care, in retirement. I didn't mention the self-substantiation earlier, but when you have an FSA or an HRA, generally you have to submit proof of your medical expense to a third party to validate that the claim was a qualified expense. With an HSA, you self-substantiate, so you just keep track of your own receipts in the event you're audited by the IRS. So you don't have to provide a proof of the medical expense every time a procedure is incurred. We saw some of the economics through some of those premium and tax savings, and talked about how one of the benefits is really employees become better consumers of their own health care when they're spending their own money. A couple proposed rules that are out there that would really make HSAs more attractive. I'll start with the bottom one actually first, the Health Savings Act of 2016. This has been proposed. It's not been passed or anything at this point in time, but this would allow spouses to make catch-up contributions to the same HSA account as opposed to having two separate ones. It would preserve HSA eligibility for people that also had just Medicare Part A. It would eliminate the need to have a prescription to make over-the-counter drugs a qualified expense, and it would have several other improvements as well. So that would definitely enhance HSAs if passed. And then there's this Health Savings Protection Act. This is something that has been passed as it relates to the, or not, hasn't been passed, has been proposed as it relates to the Cadillac tax. And not getting into all the specifics of the Cadillac tax, determining the value of coverage right now, it's been, at least in some IRS notices, said that FSA, HSA, and MSA contributions would be included when determining the value of coverage for the Cadillac tax. This Health Savings Protection Act would exempt those contributions from the value if passed and signed into law. So with that being said, I've got about 3 minutes left. I'll take a handful of questions. I'm going to throw our contact information up there for your HSA specific questions, or if you want to learn about our HSA account, the Flex Plans number or our website would be the best place to go. Do see a handful of people that have chatted in or submitted questions to the Q&A about a copy of the presentation and or a recording. We will send out a PDF copy of the slide deck as well as a recording. So that should be coming in the next 2 to 3 business days. There is a plan or a question about what about school insurance? Is that a qualified high deductible health plan? It depends on the school plan. We'd have to look at the school insurance and whether or not it would eliminate HSA eligibility. It would have to have that minimum deductible, maximum out of pocket, and no first dollar coverage. There's a question, what is TRICARE? TRICARE is health coverage that's made available to active and former military personnel. Just reading through a couple others. A question, if the health plan covers just one adult and a child, is that considered a family plan? Yes, that is, and the family contribution would be eligible. There's a question, does the money in the account grow with interest and at what percentage? That all varies on the financial custodian of the account. Some will pay just a small interest rate on cash balances. Again, you can invest the money as long as investment options are made available through the custodian. into bonds, stocks. It does vary. There's a question, can long-term care insurance be paid out of the HSA? The answer is yes, but only up to certain limits based on your age. And the IRS does put out a table each year. The older you become, the greater the amount. The younger you are, the lesser the amount. There's a question, how does being in an HSA affect Medicare participation? If you have an HSA, you can still participate in Medicare A and B. It's just once you have A and B, that's a non-qualified plan and you can no longer make contributions to your HSA. There's a question, do the HSA contribution limits apply to all funding sources? For example, family, friends, employee, employer? Yes, the total amount from all funding sources is subject to that annual limit of $3,350 for single, $6,750 for family. There's a question, can you hold expenses and get reimbursed from the account in subsequent years? Absolutely, as long as the account has been established. You do not have to reimburse yourself in the same year that they were incurred. Okay, we got several other questions here, and I'm showing we're 1 minute past the hour, so I think what I'm going to do is just call a hard stop here. And what I'll do is I will save these questions, and I will either have myself or someone else review these. If we did not get to them, we will try to reach out to you via email and send you a response to your question. But I'll just wrap things up with saying thank you very much for your time. Again, I hope you did learn a couple new things today and can see that HSAs really are a valuable tool for many employees as well as employers. And in the next 2 to 3 business days, for those of you looking for those continuing education credits related to the HRCI and SHRM, we are going to send out those certificates of completion to you. And to everybody, we will send out a copy of the slide deck as well as a recording. Again, if you do have any questions, please go ahead and contact us or visit our website. And do be on the lookout for some future webinars. We expect to have several others coming up in the next few months. Thanks very much for your time, and I hope you have a great day.